this time we're in today. From the city, we have the Executive Director of the Public Health Commission, Rita Nieves, who's to my right, Dr. Jennifer Lowe, the Medical Director, from Boston EMS, Chief Cooley, Commissioner Gross from Boston Police Department, Commissioner Finn from the Boston Fire Department, and Chief Marty Martinez, who's going to talk in a few minutes about some of the things that we're doing here in the city of Boston. We promised to give an update about the coronavirus as we get new information. First and foremost, our utmost priority is making sure residents are safe and healthy in the city of Boston and get information so they have the information that they need to move forward here. As we heard yesterday, 3 travelers who visited Boston last week for the conference in the city, the Biogen conference, have been diagnosed with the coronavirus. That includes the Tennessee case announced by their health department yesterday that incorporated Massachusetts in that. None of these travelers are Boston residents. We now have new information that there have been 3 confirmed cases of coronavirus, Boston residents tracing back to the same Biogen meeting. This is a rapidly evolving situation. We want everyone to know that we are ready for a safe and effective response to what this information is coming out every 10 minutes. We've been preparing since January when we activate our internal incident command system. Our preparedness efforts will continue to be adjusted if needed. We are happy to hear that the UMass student, and many of you have been asking about the UMass student, the first diagnosed case of coronavirus back in February, is doing well and continues to self-isolate in his off-campus dorm. Close contacts of his may have been exposed to the virus, and we'll be monitoring the signs of symptoms that will be monitored there. We continue to be in constant contact with the Mass Department of Public Health, and I just want to take a moment to thank the Department of Public Health who have been an incredible department here and doing some incredible work. I want to thank the CDC and other partners. I want to thank also Senator Markey's office is here today, representing Senator Markey and the work that he's been doing on the federal level with us. The Boston Public Health Commission and the Boston Emergency Medical Services are both well trained to respond to infectious diseases. Our Office of Emergency Management will activate the Emergency Operations Center if it's needed. Chief Martinez will speak more about the work being done on a city level and what we're doing here in the city of Boston. We're also working closely with all of our partners, with our hospitals, with our health centers, with our schools, with our community centers, with our universities, to make sure, and with our seniors and other folks in the city of Boston, to make sure that everyone has the information, the resources, and the training to respond to any potential concerns that people have. We're sharing the latest information from the CDC. The Boston Public Health Commission has fact sheets available in multiple languages, so we're making sure that other languages and people with other languages and from other countries in the city have the information at their fingertips so they don't have to figure out what it's saying. Residents can also go in the city of Boston. Residents can go to boston.gov/coronavirus for the latest updates. You can call the 311 city hotline to be connected to the next helpline. And we're looking to increase our 311 line for the expected increase in volume of calls that we're going to get. As you can see, this truly is an all hands on deck approach. We're working together on this. There's no space between any of us in this issue because there is still such an unknown that we're all, including the press in this room, trying to figure out. I want to thank all of our partners, again, state and federal partners, for their support. I also want to thank our first responders and health professionals on the front lines, both that work for the city and the state, but also in the private sector in the hospitals that we have here in the city of Boston and the Commonwealth of Massachusetts. They're ready to reach and help any challenge that comes their way. We're going to continue to deliver for the people of our city to make sure that they get the best care possible. Lastly, I want to remind everyone that we all have a role to play in keeping our community healthy. We're in the middle of a flu season, so remember to wash your hands often. And I know that Secretary Sutton is probably going to talk about this. I missed the demonstration of the day, but she's going to show me in a little while how to truly wash my hands. But it's important that there's a lot of unknowns causing potentially a lot of fear. And a lot of, and I'm going to be repeated by everybody. Washing your hands is key. Making sure that if you cough or sneeze, cover your mouth and your nose. If you're feeling sick, simply stay at home and contact your healthcare provider. Don't self-diagnose. make those phone calls, because sometimes people are concerned. A lot of what we can do, the best thing we can do today, is work on prevention. And prevention is by doing all the things that have been laid out and constantly repeating to other people on what to do. Remember also to look out for those people who are vulnerable, especially our seniors, our young people, and people with a medical history. What I mean by that is if you have residents on your street, check on your residents, check on the neighbors, make sure they're feeling well, making sure they're checking in with the healthcare providers. A lot of people don't have any family that can't do that. So we're asking you to do that here in the city of Boston. Make a phone call. Just knock on the door to make sure that they're okay if they need any help. At the end of the day, we must remember that we are a city of heart and a city of neighborhoods and neighbors, and we look out for each other and we work with each other. And I think the governor will be saying the same thing as far as it comes to the Commonwealth of Massachusetts. I want to again thank the press for being here today. You have a responsibility. You are the people that will get the accurate information into the living rooms of people in the Commonwealth of Massachusetts. We expect you and need you to get that accurate information so that we don't cause panic. So thank you for being here today. And now I'd like to introduce the Chief of the Health and Human Services for the City of Boston, Chief Marty Martinez.
Thank you, Mayor Walsh. As the Mayor stressed, we've been working to contain the virus over the last 2 months, as well as preparing for with all city partners for all scenarios related to its potential spread. It's a multi-agency response, and we also want to thank our state and federal partners for their ongoing efforts to continue to contain it. Let me give you some facts about the current situation. As the Mayor mentioned, the City of Boston has 3 presumptive positive cases of COVID-19 in Boston residents. These cases are now being tested at the CDC for confirmation, which is part of the standard process. It confirmed the number of Boston residents diagnosed with COVID-19 will rise to 4. A little bit about these cases. There are 2 females and 1 male. All are in their 40s, and all are at home self-isolating. 2 of them have symptoms, and 1 does not. They were at the meeting referenced by the mayor that was held in Boston last week, hosted by Biogen. They were identified by Biogen as people who had been in close contact with one of the earlier confirmed cases that had been identified. Due to their contact and symptoms, they were tested for the virus and have tested positive. We currently, as we speak today and standing here, are tracing who they have been in direct contact with over the last 14 days. In addition, Biogen has identified a private location here in Boston where the meeting took place. Our infectious disease staff is working with that location to mitigate the risk and to work with them on cleaning their facility and contacting and engaging with employees. It is important to note that this is not an example of community transmission, as the source of this transmission is known and is connected to a confirmed case of the virus and close contact with the patient. These confirmed cases in Boston will be monitored by public health nurses through the Boston Public Health Commission. They will provide contact tracing and follow-up support for all of the cases. The Infectious Disease Bureau will also work with MTPH, our partners at the state, to identify all the close contacts. As a reminder, a close contact is someone who's had direct face-to-face contact within 6 feet of someone for up to 15 minutes. They've had to have interaction with the presumptive case within 14 days. It's important to note, and a reminder around accurate information, this is not an airborne illness, which is important to remember. You have to have direct contact with an individual to spread it. If someone meets the definition due to the close contact work that will be done, public health nurses will provide guidance and recommendation regarding symptom monitoring, social isolation, and to contact their healthcare provider by phone if they become sick, as well as guidance on testing. The city's Infectious Disease Bureau is supporting one of the businesses affected by this, providing education to their workers on symptoms to look for, how COVID-19 is spread, and best practices to protect themselves. Again, as the mayor mentioned, it's important to keep in mind that there are many prevention strategies taking place that every citizen can do today. Stay home if you're sick. Wash your hands often with soap and water for 20 seconds. If you don't have that, use an alcohol-based hand sanitizer. Cover your cough or sneeze, and we can't say this enough. Stay home if you're sick, and also stay away from community events and venues if you're sick as well. You can reach us through 311 through the City of Boston, or as well as the Mayor's Helpline, 617-534-5050, and of course, if it's an emergency situation, to dial 911. Our priority is not only to help those Boston residents to recover, but to protect the health and well-being of Boston residents. We've been preparing for every possible scenario, its current containment and any escalation since the possible spread began in January. We continue to be confident working with our city partners, all of our city departments, and our public safety partners, as well as the state, that we can effectively manage this situation and any situation to come. None of this would be possible without our state partnerships, our state partners, and the leadership that's coming from the state. And now I'd like you to hear a little bit more about what the Commonwealth has in place and hear from Governor Charlie Baker.
Thank you very much. We're here today to support the City of Boston and our state and local public health officials to continue the Commonwealth's ongoing preparedness and planning with respect to coronavirus. As this issue continues to evolve, we are fortunate that Massachusetts is home to world-renowned hospitals and leading healthcare experts that are planning and preparing our communities and providing us with guidance. The general public in Massachusetts remains at low risk, but we are planning and preparing for the potential for more cases to develop here. I think we all know that this is stressful for people, but health experts have advised that a virus like this is not deadly for the vast majority of people who may get it. But as Director Martinez said, it is contagious, and if someone comes in direct contact with someone who has it, they might get it themselves. That means every person has a responsibility to play a part in containing coronavirus and other germs by following some simple steps you've already heard before. Wash your hands for at least 20 seconds with warm water and use hand sanitizer. Cover your mouth with your sleeve if you cough or you sneeze. Stay home if you're not feeling well and call your healthcare provider if you are experiencing flu-like symptoms and seek their guidance on the best course of action for your treatment. Our administration is working with experts and officials from our network of hospitals, first responders, local boards of health, long-term care facilities, and educational institutions. MEMA is holding weekly calls for interagency planning to coordinate with key stakeholders on long-term planning and resources should they need to pursue them to be deployed. There's an immense amount of planning and coordination that goes into preparedness efforts, and that will continue. DPH has and will continue to provide clinical and infection control guidance for hospitals and healthcare systems. Some examples to date include disseminating detailed public health guidance and recommendations to school superintendents and principals throughout the Commonwealth, and issuing guidance to long-term care facilities, including nursing homes and rest homes. We understand there are questions about international travel. Earlier this week, our administration urged colleges, universities, and high schools to welcome organized international trips at this time. Taking this precaution will help us protect both the students and the Commonwealth, as we are home to such a large number of colleges and universities. There have also been questions around large venue gatherings. We're closely following the guidance that's issued by the CDC on travel restrictions and urge all residents to follow that guidance. And here in Massachusetts, we urge organizations that are hosting large venue events to take extra universal prevention precautions. This includes disinfecting surfaces and providing personal hygiene products to attendees. It's important everyone uses common sense on this particular issue. Practice good personal hygiene and stay home if you're not feeling well. Have we said that enough times? We're going to hear it again. We will continue to follow the guidance of the CDC and encourage everyone in the Commonwealth to do the same with respect to their daily activities. Our administration remains committed to serving as a resource for the City of Boston and for all entities who are on the front lines of these ongoing efforts. And please continue to check the banner at the top of mass.gov for important updates as they become available. And we'll continue to keep people informed as new information becomes available to us. Again, I understand that this is stressful for many people. But as I said earlier, experts from the U.S. Center for Disease Control and the World Health Organization are finding that for the vast majority of people who contract this disease, it is not deadly. It's also important to remember that the spread of this disease can be pushed back. Some parts of the world have started to see some positive progress that were involved in some of the earliest outbreaks. But that's only made possible by people paying attention to the guidance that local, state, and federal officials are putting in front of them. And it requires people to pay close attention to their actions. lots of hand washing, covering coughs, and staying home if they feel sick. This is a very serious disease, and we are pursuing all appropriate action and developing the resources that we need to confront it. And we will continue to offer everyone the most complete information we can as it becomes available. I also want to thank the City of Boston and many of our local colleagues across the Commonwealth for their steadfastness, their cooperation, their leadership on this. For more details, I'd like to turn it over to the Secretary for Larry Suggs.
I will be brief because I will spend all my time demonstrating appropriate hand washing. Thank you, Governor. Thank you, Mayor and Martinez, for the strong partnership between the city and the state. I'm going to be very brief, and what I really want to do is to go over some numbers with folks. So as you know, in the Commonwealth of Massachusetts, there is one confirmed case of COVID-19. We now have 7 presumptive positive cases. I'm going to do the totals and I'll break it down. There are 4 in Suffolk County. There are 3 in Norfolk County, and there's 1 in Middlesex County. You heard from Chief Martinez, the 3 from the Biogen conference. There are 2 additional presumptive positive cases from the Biogen conference, and those are the 2 individuals in Norfolk County. Do the numbers again statewide. We have 1 confirmed COVID-19 case. That is the young man who came from Wuhan, China, earlier in February 1st, I believe. And we have in Suffolk County the 3 that Chief Martinez referred to. We have 3 in Norfolk County, a male in his 40s who returned from an organized school trip in northern Italy, and the 2 individuals who were exposed at the Biogen employee meeting. And then we have 1 individual in Middlesex County, a woman in her 60s whose recent European travel included northern Italy. All these individuals are recovering at home, or at home without symptoms. Additionally, new information since yesterday, the last time the governor had a press availability on the subject. So last evening, the Commonwealth of Massachusetts formally requested for personal protective equipment and the strategic national stockpile. And we're expecting to hear shortly back from the federal government. Again, as you've heard from all of us, we continue to prepare and plan as the evolving nature of this illness changes, and we're open for whatever questions that you have available. Thank you.
What can you tell us about this case we've heard about the last?
So we do not identify individuals by town. As we said, we now have 3 individuals in Norfolk County, including 2 individuals who were exposed at the Biogen employee meeting. 1 individual in their 30s and 1 in their 40s.
So is the Wellesley case a Biogen employee?
So the 2 newest Norfolk County cases are individuals who are associated with Biogen.
And there's 5 Biogen, there's 3 in Boston and 2 others, so 5 Biogen employees altogether.
Yes, that are presumptive positive.
Secretary, would you say that community transmission is likely at this point? And do you feel you have enough test kits to do that locally? I mean, how many people do you think eventually you'll have to test?
So we don't speculate, as you know. I'm going to bring up Commissioner of Public Health, Dr. Burrell. We do have enough test kits at this time.
How many test kits do you have?
So we test about 40 to 50 individuals. We have the capacity to test 40 to 50 a day, and we have the ability to return tests back within no later than 24 hours. So we're staying current with testing.
Is that
The rest of your question was?
But 40 or 50 test kits a day.
No,
And
40 or 50 tests a day.
And are you concerned about
There are a lot of
community
tests.
transmission? Are you concerned about community transmission, that is inevitable?
No, so all of the presumptive positives today are all associated with someone who's either traveled internationally or was confirmed as COVID-19. So this is not community spread.
We've been told people going to MGH and MPH is turning them away when they're asking to be tested, for instance. Have you heard that? Are hospitals, do you believe hospitals are overwhelmed as well?
So in response to the question about, it really does connect back to testing. And to be clear, the guidelines for who should be a person under investigation related to this have recently changed to be expanded to appropriately allow a clinical judgment to go into place so that if a clinician is seeing someone that they believe should be tested, that would be accessible to them. So that change has come in this week. With that change, at the State Public Health Lab, still the only place in Massachusetts that can do testing, we have asked for and received from the CDC increased number of test kits to build up to that. Individuals come through multiple different hospital systems, and we're working closely with the hospital systems to talk about how to triage this effectively. I will note that the CDC is also reporting that shortly other labs will be able to perform the test, and that should decrease the burden.
So it sounds like hospitals are.
Hospitals have been preparing and are prepared to do the work that they need to do in regular contact with them and keeping up with the number of beds that they have filled and the supplies and such. And in fact, the information that we had from hospitals about the need for supplies is what triggered our asking for that.
How long does it take for the state lab to test? And specimens would be sent to the CDC, it was like 3 or 4 days. How long is that turnover now at the state
Our
lab?
turnaround at the state lab for these tests, depending on volume, is approximately 24 hours.
So you're able to
Some of the
test,
hospitals are wondering if you were going to be able to sort of increase and more rapidly test because they are sort of feeling overwhelmed. So they have to follow additional protocols in their emergency rooms now when somebody comes in and says, I'm sick.
Absolutely, and their message that you can help us share is that if an individual feels that they need to be seen because of possible COVID-19, they should call ahead, because then the healthcare system, whether it's a clinic or the hospital, can follow the procedures that are well outlined and well known by the healthcare system in order to prepare for their arrival. We have increased our capacity at our lab over to be able to do the testing, and I'm confident that when other sites are able to do testing, that'll be some capacity.
So you're able to test 40, 50 people a day. Is that what you're doing now? So 40, 50 you're able to do, is that what you're doing now?
That's roughly what we're doing now, and it changes on a daily basis.
And so when will Mass General, for example, be able to do testing in their own lab? Are they working on that? When do you expect other labs to?
So who can do the testing, and I know it's a confusing topic, who can do the testing is determined at the federal level, at the FDA. And so the FDA is working to be able to have commercial availability of this test, and we're told it will be shortly.
Is that if schools has closed already? Is that an appropriate response to close preemptively? And could you give us a sense of, for example, at what point would you recommend against large gatherings, or just where are the thresholds where you bring in additional measures for social distancing?
First of all, I can't speak to the schools that I've seen them closed around the Commonwealth, but I think it goes back to getting accurate information out to people and not causing panic. And I think that the appropriate medical personnel can explain to you about how the coronavirus potentially can be transmitted. And we had a pre-meeting before this, so I learned a lot about that. And I think that it's not necessarily the airborne disease where somebody coughs and it's in the air for a day. And I think that has to be thought of. I think that it also tracing back is important for us. At least I'll talk for the city of Boston. If we have a situation where a young person in our school, because of their parents' travel or what have you, thinking that the parent might have the coronavirus and it's not a positive test, reacting without really thinking through that process is a mistake. So what we would do is do our own, do an investigation with the Public Health Commission to find out why is there a fear that a young person in the school's parent might think they have the coronavirus. And it could be just the fact that they have a cold, they watched it on TV, they think the symptoms they have the coronavirus. It could be that they came in contact with somebody that was in northern Italy or came from China. So we would do our own kind of investigation in that particular case to make sure that everything is safe. And we would pass that information down. And I think that what's happening is a lot of people are jumping to conclusion here and making decisions which I don't want to say are not the right decision, but making very rash judgment decisions right now. And I think as we get into this, as we go on, we're going to have more protocol in place. So it is key for the city of Boston, for our community centers, for our schools, for our charter schools, for our parochial schools, to follow a protocol. And that protocol is if we think that somebody is somewhere is connected to coronavirus, we then will follow the steps and take the investigation and get the state involved, so we're following this through. There's still an unknown fear as far as some of the questions that have been asked there. So I think we have to take a step back. As far as the large venues go, again, the same thing. I mean, the secretary talked about it, the governor's talked about it, making sure that whether it's large venues or our schools or our train stations or airports, that we're doing proper cleaning in there, that we have hand sanitizer in there, that people are washing their hands, that people are covering their mouth when they're coughing and sneezing. All of those things will help us moving forward. As far as the large venues, they're in the same category. Cleaning down the TD Garden, cleaning down Fenway Park, thinking about all those different areas. I mean, we're monitoring this around the country, around the world. I think there's been 4 marathons canceled right now. We're not there in Boston right now. Yes.
How about the parade next weekend?
No, we're not there. We're monitoring the situation literally day by day to see what's going on. And again, talking to the medical experts, getting the information from them, not reacting. If the medical experts say to us, if I'm told by the medical people here that there is a problem having the St. Patrick's Day parade, or there's a problem in other parades, then we will take the appropriate action. But until the medical professionals come to us and say, we need to shut everything down, we're going to continue just to pass information out to people, what they need to do to take precautions.
Where was that biogen? Clarify, 5 biogen cases, 3 in Suffolk and 2 in Norfolk. Is that correct?
Could you go over the numbers again? Could you go over the numbers?
I just want to make sure I have the right information. 5 biogen cases, 3 in Suffolk, 3 out of Suffolk.
3 in Suffolk and 2 in Norfolk County.
Is the one confirmed case also counted in that 7 presumptive positives?
No, remember I said there's 8 total.
8 total
1
cases.
confirmed that the young man who came back from Wuhan.
So then what's the
And
4th
others
in
are-
Suffolk
And
County?
the others are presumptive positive.
Are there 3 or
What's the
4
other-
from
what's the
Suffolk?
4th in
Okay,
Suffolk
I'm
County?
Or,
Wait, I
sorry.
thought I did that so clearly.
No.
Okay, we ready?
Yeah.
All right. 4 in Suffolk County. Right? 1 is the confirmed COVID-19, the young man who came back from Wuhan. The other 3 are individuals who were at the Biogen employee. 3 in Norfolk County. 3 in Norfolk County, 2 of whom are connected to the Biogen Employee Conference. 1, the other one in Norfolk County, is a male in his 40s who returned from an organized school trip in northern Italy. And then 1, a woman in her 60s in Middlesex County, who also had recent European travel, including northern Italy.
Was the
So can I
Norfolk
go back
County
to where was the
And all of this is up on the mass.gov.
Even the
Well, and I thought you liked mine.
So if you're
So we're
cleaning
able to
where
test
was the
40
biogen
50.
conference, if you're cleaning someplace now, where would that be?
So the Biogen, it was a leadership meeting, and it was held at the Longwharf Marriott here in Boston. And we are Boston Public Health Commission and infectious disease and communicable disease staff have been working with them to look at cleaning protocols and procedures so that they can help them be able to make sure that they mitigate any risks.
And that was
in the space.
last week.
That was last week.
So should people who've been to the Marriott Longwharf, who work there, who, profess, should they be worried?
So what I'll tell you is that we were in communication with the staff there to help them look at cleaning, to help them understand. Again, we're not talking about an airborne, right? We're talking about folks who are in close contact, and that's how the virus spreads. So again, and I can say this, and I think they released, the Marriott has had a in play and in protocol already, deep cleaning process in place for about the past 6 weeks. So they were already very prepared, especially we're in flu season, as to remind us all. So they were already doing that. So again, we've already met with them. We actually met with employees this morning over at the Marriott to make sure that they're informed and understand what they can do to keep the place clean and healthy.
So we're able to test
No,
40
but I have a
50.
quick question about the marathon. What cue would you take? Would it be the CDC? Would it be your own public health professionals to perhaps advise, and Mayor, the same thing for you, that the marathon should be scaled back like it was in Tokyo?
Well, I would take most of my cues from the city and the CDC and our own public health people. I think the point the mayor made about This is one of those areas and circumstances where you take the best available data you have, and then you listen to the experts, and you make your decisions based on the guidance you get from them. Fauci, the gentleman who was driving the train here, Dr. Fauci, at the federal level, I mean, he's been working this stuff for 30 years, 40 years. I mean, he's kind of seen it all and done it all. And we spent an hour on CNN last night, and I would urge anybody who wants to get a deep dive from somebody who really knows what they're talking about, to watch that one on our show.
Governor, some
Can you talk about the
they
business
weren't
that
notified until yesterday about a presumptive positive that was released by the DPH on Monday. So why the lag time? There were 4 colleagues that were involved in that patient. Is that inaccurate?
I can't comment on that specifically, but I will tell you that we have a protocol in place that we heard also from the city of Boston. It's a standard public health protocol. When the presumptive positive comes back, we notify that individual's provider who ordered that test, and they then work to inform the patient, and we work very closely to find the contacts and people around them.
And can you just,
Can we
back
just
to the
get
point
some
of
clarity on Norfolk
testing,
County?
under the new guidelines, the expanded guidelines, obviously more people get tested now. So for the point of the concern of hospitals, I mean, are they seeing too many people now coming in that they can test for?
So we're working very closely with the hospital systems. We've done broad dissemination of what the new guidelines are. We appreciate that it allows for clinical judgment, which is an important part, and we're working very collaboratively with them, and I'm hopeful as the test is expanded in terms of locations, that will be good.
But hospitals that aren't seeing too many people at this point.
And just to
What are we
clarify, the
expecting
city
to
is doing 40 to 50 tests per day, and how long is that sustainable? Are you still getting increasing supply?
Thank you,
Can we
everyone.
just get some clarity on Norfolk County? The state previously announced that as a woman in her 20s. Today, Madam Secretary, you said as a male in his 40s. What is the case in Norfolk County?
So I didn't bring the ages, so can we just verify with you?
Yep.
After?
Sure.
Thank you. Appreciate your time.
Wow.